This morning, we're learning of two significant breakthroughs in the battle against cancer. We're going to look at a new advance against breast cancer in just a moment, but we begin this morning with a new drug that, according to clinical tests, can slow down the spread of melanoma, the deadliest form of skin cancer. CBS News correspondent Cynthia Bowers is in Chicago with the latest on this for us this morning. Cynthia, good morning.
Good morning. It is hard to overestimate the magnitude of this new drug's potential when you consider that melanoma kills nearly 9,000 Americans every year, which is one person on average dying every hour.
Researchers say this pill, vemurafenib, is a breakthrough when it comes to slowing melanoma, the deadliest form of skin cancer.
So patients who get the vemurafenib, sometimes within 72 hours, are already much better, off of pain medicine, maybe off of oxygen.
Unlike chemo, which attacks healthy in addition to unhealthy cells, this drug works by targeting only a genetic mutation blamed for increasing the cancerous cells. It's called BRAF. It's a mutation that's present in half of all melanoma patients. Since vemurafenib targets only the mutated genes, it appears to be much more effective and causes far fewer side effects. After 6 months, 84% of patients on this drug were still alive, compared to 64% on traditional chemo. Vemurafenib has given stage 4 melanoma patient Susan Steele something money can't buy: time and quality of life.
I was headed really to death because I had brain metastases, and that's usually the end of the line for melanoma patients. Within 7 days of taking the drug, once I got on the trial, I had about a 40% reduction in tumors.
Researcher Lynn Schuchter cautions this is by no means a cure.
Over time, the melanoma cells can become resistant to the therapy, and then the cancer cells outwit these new drugs and outsmart us.
Now, this drug will be used in concert with that triggers the body's immune system to fight the cancer. That's the good news. The bad news: melanoma is the fastest form of skin cancer growing among young people in their 20s. And Chris, it is primarily due to simply too much sun exposure.
CBS's Cynthia Bowers in Chicago this morning. Cynthia, thank you very much. That's the one thing you cannot stress enough. You need sunblock, and you have to be careful when you are out in the sun. Let's bring in medical correspondent Dr. Jennifer Ashton right now, and let's just talk about this melanoma drug real quick. Side effects.
There are always side effects, Chris, and particularly with this drug, increased risk of secondary skin cancers, a sensitivity to the sun, joint pain, fatigue. Those are really the biggest ones.
Okay, and now I want to talk about this breast cancer study that we've been talking about, this other cancer study making big news here this morning. Breast cancer, as many will know, is the second most common cause of death from cancer in women in the U.S. So this study, what does it mean towards prevention of this?
Well, really, this really signifies the paradigm shift here. We've gotten very good at treating breast cancer. Now the bent of the research is focused on prevention. And to put these numbers into context, this very reputable study in the best medical journal we have, they found that they had to treat 94 patients. These are high-risk women with this one particular drug to prevent one case of invasive breast cancer in a 3-year time period.
Now, the study looked at a class of medication called aromatase inhibitors here. How do these drugs work to reduce breast cancer?
Well, when you think about it, Chris, of all of the women who are battling breast cancer, about 2/3 of them have a form of the disease that we refer to as being hormonally sensitive. Basically, this drug works as an anti-estrogen. And we do need to mention here, Chris, that this study was funded by the drug maker, although they did not have a direct role in how the data was collected or in the study design.
Okay, well, now the women that were involved in this study were all classified as high risk.
That's right.
Now, what classifies someone as high risk and someone else who isn't?
Well, both in this study and in general, when you talk about high risk for breast cancer, age is the #1 factor. Over the age of 60 were the women in this study, postmenopausal women. Other things that make you high risk: your family history, or if you've had another type of breast cancer in the past.
Okay, and aromatase is the drug that was used here again.
That's right.
And side effects with this drug are?
Well, they can be pretty troubling. They can be hot flashes, fatigue, joint pain. In fact, women on this class of medication have a high discontinuation rate of stopping those medications when they already have breast cancer. So it remains to be seen whether women who don't yet have breast cancer will be able to stick with those side effects.
But two very important studies here this morning.
Absolutely, we're going to be watching them.
Dr. Jennifer Ashton, good to see you here this morning.